Hi everyone, my name is Stephanie Linning and I'm here to talk about pre and postpartum pelvic floor and core. I am a wife, a mother, and a physiotherapist. I love to be outdoors and active. My biggest kind of goal as a physiotherapist is I love to help others achieve their rehab goals and get better in whatever capacity that is. I have 3 wonderful boys, 11, 8, and 5, and we love to mountain bike and hike and just generally be outdoors. I also have a dog. Her name is Piper, and she is my sidekick and companion for all of the outdoor adventures we go on. What is pelvic health physiotherapy? So pelvic health physiotherapy is the assessment and treatment of dysfunction of the organs and muscles, nerves, and connective tissues in and around the pelvis. So as pelvic health physiotherapists, we are largely concerned with that specific region of the body, but it is by no means that we don't care about the other parts. Many other areas of the body from head to toe can influence how the pelvic muscles work and how well the pelvis itself creates stability and contributes to movement. So there's several different functions of the pelvic floor. So it helps to support internal organs, the sphincters, so urethra, vagina, and anus, that's sphincteral control. Sexual function, so it relaxes for penetration and contracts for orgasm. Pelvic stability, so you're looking at like how the pelvis actually helps to stabilize to create better movement of the trunk and the legs. And it acts also as a sump pump. Many people don't realize that the pelvic floor actually it helps with our circulatory system and to get the lymphatic fluid from the legs back up to the heart. So a lot of people, especially a lot of women actually in pregnancy will kind of talk about how they feel really heavy and kind of just really full down in the pelvis sometimes. And that's actually sometimes due to pelvic congestion, which in turn is the pelvic floor not doing its job well as a sump pump. It's really important, the pelvic floor, in breathing. So the diaphragm and pelvic floor work in synergy during breathing. So we'll talk a bit more about that on another slide. So just an overview of our core muscles. So our pelvic floor is part of our core muscles. We also have our transverse abdominis, which is the deepest layer of the 4 abdominal layers. Then we have our multifidi, which are the tiny, tiny muscles in the back that support kind of 2 to 3 segments. And then we have our diaphragm up under the ribs. So it almost creates a bit of like a piston in a vehicle where you inhale, the diaphragm comes down, the pelvic floor descends, and the transverse abdominis and the multifidi expand. And then as you exhale, the diaphragm comes up to shunt the air out of the lungs. The abdominals and multifidi kind of come in again, and the pelvic floor contracts. So there's several layers as well on top of that. That's just showing you the deepest layer. So going back to a little bit, go into more detail with the breathing in the pelvic floor. So it is a bit of a pressure system. So if you look at the diaphragm and the pelvic floor and kind of the core as a balloon. So if your diaphragm is creating too much pressure, and you can visualize that diaphragm kind of squeezing the top of the balloon, the actual pressure will go down. And so that's not always a good thing. You want to kind of manage that pressure. You want that pressure system to stay relatively low and not increase. So the diaphragm and the pelvic floor, like I said on the previous slide, do work in synergy. And on inhale, the diaphragm descends, the pelvic floor expands, the abdominal and deep back muscles expand. And then as you exhale, the diaphragm comes up and in, the abdominals contract, and the pelvic floor contracts. So myths versus facts. So these are common thoughts and comments of women everywhere. So I leak too. It's normal once you've had kids. I feel like I have to pee all the time, but only a little bit comes out. I leak a little when I run, jump, skip, even though I do my Kegels. So sometimes we think that this is the norm and this is the way it has to be after you've had kids, and the simple fact is it does not. most accept it as normal because they don't know any different, and some accept it because they choose to or are okay with it. So but the best we can hope for is we want everyone to have an informed choice. So we want to educate and kind of give everyone what they need or want, right? Some people are going to want help and some people may not be ready to seek help, and that's okay too. You have to be ready and you have to be willing to ask for help and kind of understand and be ready to take in that information. So looking at pelvic floor dysfunction, there's different types of dysfunction. So there's incontinence, pelvic organ prolapse, pelvic girdle pain, which is quite sometimes often with, that even can start in the first trimester of pregnancy, back, leg, hip pain, and diastasis rectus abdominis. So some women are lucky they don't have any of these issues. Nothing kind of comes after having babies. And some other women have several kind of different kind of combinations of these issues. And we kind of assess and treat depending on what those combinations are. So the definition of incontinence is basically any unwanted loss of urine at any time and of any amount. So that's whether it could be as little as sometimes I leak when I jump on the trampoline, so I just don't jump on the trampoline, but you still don't have to leak when you jump on the trampoline. So knowing that that still is a type of incontinence. So looking at types of incontinence, we have stress incontinence, which is actually the most common type, and urge incontinence, which is the second most common type. We sometimes also see overflow incontinence, depending on how the organs are sitting in the pelvis. And sometimes with neurological conditions, we might see like a reflex incontinence. We treat stress incontinence and urge incontinence very, very differently. So just because you have incontinence and you think, hey, I'm going to just do my Kegels and hope it gets better, that's not always right. It's not all about the Kegel. So looking at pregnancy-related pelvic girdle pain, it can occur anytime during pregnancy, and it's not always related to the relaxin in your body. Sometimes it's created with, it could be as simple as the pressure system, like that diaphragm and pelvic floor muscle are not working as well as before. It can be actually related to increased tension in that system as well. So getting an assessment and proper treatment specific to you is important during pregnancy or even postpartum. Preparing for your pelvic floor for birth. So looking at birth prep breathing. So typically I do one session prenatally on push prep breathing and how to work with your pelvic floor and core during labor and delivery. Quite honestly, it can be very effective to learn how to breathe and let your pelvic floor lengthen throughout labor, so you're not having kind of your body fight the labor. You want to work with that rhythm, in rhythm with your body. So also looking at finding a quiet and dark space. Like if you're in the hospital, ask them to dim the lights. If there's lots going on, there's no reason why you can't ask for more quiet. Find a rhythm and a routine. So looking at, if you watch moms in labor regularly, like some of the doulas would, a lot of them will find a rhythm. So looking at rocking or swaying in a rhythmic pattern, or even breathing in a rhythmic pattern, or even repeating a mantra in their head, like, for example, inhale, exhale, any kind of mantra that would help with you to kind of get through labor. And then also realizing that moaning, yelling, sighing, or screaming are all normal, and that it actually helps to relax the pelvic floor and open the pelvic floor to allow delivery. So exercise during pregnancy. So it is recommended that 150 minutes of moderate activity per week. So that's looking at 5 days a week. You should be getting about 30 minutes of moderate activity. During pregnancy, do what's familiar to you and what you enjoy. But that does also you have to make sure you avoid contact sports, avoid overheating, like during hot yoga or hot saunas. Avoid activities that have a high risk of falling, like mountain biking, for example. And yes, you can start a new activity during pregnancy if you haven't been physically active. So yes, you can start exercising if you haven't been physically active. So walking, doing some prenatal yoga on a weekly basis, even riding a stationary bike. All of those activities are good just for keeping your body moving and functioning well during pregnancy. So diastasis rectus abdominis. So basically during pregnancy, the linea alba, which is it's the ligament in between the two recti muscle in your tummy, like your six-pack muscle, it does separate during the third trimester. So rarely, there might be a rare pregnancy that either you go into labor prematurely or for whatever reason, the mom isn't very large through their abdomen, that there will not be a separation. But with most pregnancy, there is a degree of separation. And the separation depends on many factors. It's how you carry your baby, any genetic, kind of how your mom or your grandma carried their babies, and then also just body type and the amount of collagen you have in your fibers as well. So these are kind of variations in how you'd see different separations. So within our clinic, we would do an assessment to see if there's any separation and then treat that appropriately depending on where the separation is, and then progress to more core exercises after. So here's actually a picture, and you can see how when the mom is kind of tucking her chin and lifting her head up, there's a bit of a bulge here. And then even down here, you can see there's a bit of doming through the tummy. So looking at the ability to create tension around the linea alba is important. So again, looking at functional diastasis rectus abdominis versus non-functional. So some people, functionally, the muscles are functioning okay. There's a bit of separation, but the muscles are overcoming that little bit of separation. And then some women, like in this individual here in the picture, you'll see that their muscles are not functioning to kind of bring the tissues together. So then in physio, we'd work on getting those muscles to function and coordinate better so that that separation lessens and they have more stability through their abdomen and pelvic floor. So, and this is not only exclusive to pregnant women, as you'll see in the next slide, a bodybuilder can have a separation. So if you look in the center here, you can see that separation. He's fully functional. He has the ability to probably do amazing things with his body, but that separation is very evident between his two recti muscle in the front. And because he's so lean, you can really see that separation. But that's lower, deeper system in his core is probably functioning well, even though that separation is there. So you wouldn't have to do surgery or anything for this, but he has learned how to function. And why he has that separation, we're not actually sure why. So looking at pelvic floor engaging and relaxing. So if one of the four muscles are not working optimally, it can throw off our whole system. And this is sometimes hard to coordinate without one-to-one support in a therapy session. And sometimes people can learn from others or in a class or group class. It just depends on how you learn best. So if you try lying down or even just reclining and inhaling, feel your abdominals expand, feel your pelvic floor expand. And then as you exhale, feel your abdomen come in, feel your ribs hug together and your pelvic floor contract, and then repeat. So this is an exercise that is actually really, really hard for a lot of people. It's really hard to coordinate that breathing and the diaphragm and the pelvic floor together. It's really hard to understand how they kind of work together, and some people get it right away. So if this works for you and this is enough, that's fine. But if you are dealing with any issues, you might need to come see someone. So integrating into exercise. So depending on what you're dealing with, whether it be pelvic pain or incontinence or pelvic organ prolapse, sorry about that, I'm gonna give you certain exercise to help. These are some examples of exercises that I would do, but depending on the person and where they're at, I would give them very specific exercises. And my inventory of exercises is much, much larger than these kind of listed here. But it's just an idea of things that you can do. If you're dealing with pelvic pain, for example, I would traditionally try to get you to do some pelvic relaxation exercises. So we'd always start with deep breathing to lengthen the pelvic floor. I might get you doing some window washers, which are just simply lying on your back and letting your legs going side to side to feel that kind of relaxation through the hips. Happy baby pose is really nice. So lying on your back with holding onto your feet with your legs up above you. And pigeon pose is a nice one. Pigeon pose can be modified for during pregnancy. You can do it with a block under your hips or 2 blocks under your hips so that it gives you more space for your belly, and not leaning forward over your front leg is also another way to modify that. Core activation. So if you're dealing with that kind of postpartum diastasis rectus abdominis, if you think that you have a bit of instability there. So again, we'd start first with some deep breathing and learning how to contract the pelvic floor. Then we move on to doing some core things like maybe glute bridges or doing some contraction while you're doing a squat, or potentially looking at core activation and progressing through some core activation exercises. So one example of core activation is lying on your back. You engage your pelvic floor, you engage your transverse abdominis, and then you gently lift one foot and tap down, lift one foot and tap down. So you can really feel those abdominal muscles engaging through there and progressing into different exercises like dead bugs or what would be another one? Side planks and different exercises that we could go into. It's really, really difficult to generalize, and usually you need one-to-one assessment and really specific exercises for where you're at. So again, these are really general and may not work for everyone. So then looking at, this is kind of an exercise I'd give to someone who's dealing with stress incontinence. So you have a good idea of how to relax and kind of contract the pelvic floor. We've talked about that a little bit in a few of the previous slides. So actually thinking about actually just contracting the pelvic floor and holding as long as you can without letting go and repeating that. So as just like any other muscle in our body, we need to overload that muscle to create gain in its strength. So if you're dealing with strict stress incontinence, you have some leaking with cough, sneeze, or laugh, that kind of thing, or jumping, you can gain more control by doing this type of exercise where you're really engaging and holding for a period of time and repeating that on a regular basis. The other thing is we do have fast twitch and slow twitch fibers in our muscle, in our pelvic floor, just like everywhere else in our body. So type 1 are more slow twitch and type 2 fibers are fast twitch. So fast twitch is being able to contract the muscles quickly. So when we're having some leaking with cough, sneeze, or laugh, if you practice that on a regular basis, you maybe look at your watch and set a timer for 10 seconds and you see how many times you contract, relax quickly in that time period, because that will help you train to contract quickly when you're getting that kind of leaking. And last but not least, looking at postpartum. So tips for postpartum recovery. So normally you go to the doctor or your midwife or your practitioner, and at 6 weeks postpartum, this is not the green light. This is not the green light that you can go and do everything that you were doing previously. We need to build up slowly. It took 9 to 10 months to grow a baby, and sometimes it takes like 10 to 18 months to get back to feeling normal. You throw in kind of breastfeeding in there, which is so important as well. But it can also kind of still keep your hormones a little bit out of in a different space than when you're not breastfeeding. So do your pelvic floor breathing at 4 to 6 weeks. and follow up with a pelvic health physio if you have any issues. So if you're having any pain with intercourse or leaking or any separation at 6 to 8 weeks postpartum, that's when you might want to seek some advice from a pelvic floor physio. So I'm in Port Alberni, and I'm a pelvic health physio, and my clinic is called Pivot Physiotherapy. I am in the Alberni Natural Health Group building on Elizabeth Street, and my phone number and my website is there. If you have any questions or concerns, you can contact me. I also have an email address on the website that you can email me at as well. So take care, everyone, and happy birthing.